Before I begin my venous refill study, I like to precondition the patient's veins. A lot of times during the examination, the dorsiflexion, plantar flexion motion will cause the veins to expand. So by doing this simple maneuver now, you will condition the veins to be ready for the examination. I'm going to have the patient do 10 or 12 toe raises. So he's going to raise up on his toes, down, and have them do those 1 per second. And after they finish with 10, have the patient take a seated position on the exam table with the legs hanging dependent. This study can also be performed with the patient seated in a chair, but it limits the motion of the foot action. In this video, we're demonstrating the proper technique for performing the venous refill examination. The first step you're going to do is take your right PPG sensor. To remove the PPG sensor from the clip, simply open it up, push it through from the bottom, and then remove it down through the access hole. Place the sensor in the middle of a strip of Velcro. You can also use medical grade tape. For placement, measure about 4 fingers above the medial malleolus and place the sensor snugly against the leg with the tape or the strap. It's a good idea to precondition the veins before you begin your examination. Press the reset button on your right venous refill screen, and we're going to wait for the patient's venous flow to stabilize. As we can see on the top of the screen, he's still filling by that upward rising line. Keep pressing the reset button until the patient is no longer filling and the line stops rising. When the line is settled, have the patient do dorsiflexions, plantar flexions at about 1 per second. And have the patient keep repeating these until the downward spike on the sensor line is no longer falling. Then have the patient relax their legs and simply wait until you see the ascending line cross the baseline. In certain instances, this will not occur and the rising line will plateau before crossing the baseline.